name is Dr. Dadvand. I'm a board-certified plastic surgeon here in Los Angeles, and welcome to my YouTube channel. My practice primarily focuses on plastic surgery of the breast and body, with a specific focus on gynecomastia and F to M top surgery. So today I want to talk about revision gynecomastia surgery. Now, gynecomastia is a problem that a lot of guys have dealt with for years, and so when the time comes for them to have surgery, it's typically a very momentous occasion, and most of the time everything goes great, but as we all know with surgery, sometimes things don't heal as planned, and there's a small percentage of guys who do need revisions. So let me just start off by saying that any surgeon that says they don't have revisions or complications is either lying or they're not a surgeon. And so I've certainly had patients in my own practice that I've had to do revisions on. Not often, but they have existed. So we can essentially break down revision gynecomastia surgery in two broad types. Number one, guys who've been over-resected, and number two, guys who've been under-resected. So over-resection is exactly what it sounds like. Too much was taken out. Now, whether that's fatty tissue taken out or breast tissue taken out, what ends up happening is that you get concavities. We call this cratering, and it typically happens in and around the areola and nipple, but it can happen anywhere in the chest. So correcting over-resection can be very challenging, but in essence, what you want to do is build up the areas that too much has been taken out so that cratering or concavity can be supported and built up to get a smoother contour. Now, my favorite go-to technique is a fat flap. And what that means is taking the fat that's around the cratered area and then dividing it in a way and rotating it in to fill the cratered area up. Now, the advantage of a fat flap is that it doesn't disrupt the blood supply, so it's a very predictable correction, meaning that that fat won't dissolve or reabsorb because it's not being transplanted from a different part of the body. Now, if a patient doesn't have enough local fat in the chest to be able to rotate as a fat flap into that cratered area, the next option for me would be to use fat grafting. Now, fat grafting means I take fat from a different part of the body, typically the belly or the love handles, and I graft it into that cratered area. The advantage of fat grafting is it's still replacing their own fat with like fat, and so it's a natural result. But the disadvantage is that some of that fat will inevitably be dissolved or not survive. So the predictability level is not as good. Now, another way to correct over-resection, especially in patients who are really lean, and areas that are not that big, meaning their concavity is over a very small area, is a relatively new procedure called Renuva. Now, Renuva is an in-office procedure, and it's basically an injection of stem cell fat. And so this fat is harvested from cadavers, processed so it's nice and sterile. And I do this procedure in the office, and typically it takes 1 or 2 sessions to completely restore. But to know that whatever's injected, about 20 to 40% of it dissolves. And so you don't want to overcorrect in this case. You just correct and then have the patient come back in a couple months to see if they need a little bit more. So the advantage of Renuva is that it's not a surgical procedure, so no anesthesia, it doesn't cost as much, and there's not the downtime that comes with surgery. The downside is that it doesn't work really well for large areas of cratering, and the reason why is because it just gets too expensive to use, and so I prefer in larger areas of cratering to use the patient's own tissues, whether that's a fat flap or fat grafting. So the other broad category of revision gynecomastia is when not enough tissue has been taken out or they're under-resected. Now, you first have to establish what that fullness is still being caused by. So in some cases, it's residual breast tissue that wasn't taken out. In other cases, it's because there's scar tissue that's formed that makes it look and feel like breast tissue. So the way that I distinguish between the two is I ask the patient, okay, right after the surgery, when the bandages came off, did everything look really good? And then over a month or two, did it start to grow again? If the answer to that question is yes, then that's not residual breast tissue. That's scar tissue that's probably formed over that first 2 months. But if the patients were to tell me that right after the bandages it still kind of looked full and it never looked flat, then that means that not enough breast tissue was taken out. And so it's really important to define whether this is residual breast tissue or scar tissue, because if it's scar tissue, it might not need surgery. You can do massage, you might be able to do Kenalog injections to dissolve that scar tissue and get the desired outcome. However, if it's breast tissue, then it needs surgery. No amount of Kenalog or massage is going to make that breast tissue go away. And these patients then need to go back under the knife and have a very kind of finesse procedure to take out that residual breast tissue, take out enough, but not cause cratering, so you're now in a vicious loop. So in this example, this patient had cratering from a prior surgery done by a different surgeon. And you can see that this patient is over-resected and they're cratering in certain areas. And I approached this with fat flaps. And so what I did was taking fat from around the cratered area and rotated them in and sutured them into position so they can correct the defect. And here you see in the after position that the correction is really good, looks a much natural chest, and this is a permanent result. So here's another example of a patient who came to me because they were cratered. The patient had surgery somewhere else and came to me because they weren't happy with the overresection and the cratering of their areola. And in this situation, I opted to do fat grafting because they didn't have enough local fat for me to rotate into place. And so I liposuctioned their abdomen and their flanks, harvested the fat, processed it, and then injected into the cratered areas. And here you can see in the after result a much better contour. Now with fat grafting, sometimes it takes more than one surgery to build the chest back up, and that has all to do with how much fat the patient retains the first time around. And some patients are fat retainers, some are fat burners. And so if a patient burns through more of their fat than you wanted to, you might have to bring them back and do another fat grafting procedure. Now here's an example of a patient who was under-resected. And this patient, based on their history, I knew was not scar tissue because they said that after the surgery it never really looked flat. And so that tells me that that was probably residual breast tissue. And so we went straight to surgery. And for these patients, I usually have them wait at least 6 months from their last surgery to let all the inflammation settle down before I go in and operate. So I know exactly how much fullness they have that I'm dealing with. And so I went in and I took out that extra breast tissue and was very careful in sculpting the chest, and you can see in the after result the significant improvement in the contour. Now, for the purposes of this video, I divided revision reasons as over-resection or under-resection. Now, that's a great oversimplification of all the reasons why guys would come in for revision surgery. Sometimes it has nothing to do with over-resection or under-resection. Sometimes their skin ends up being too loose or their nipples are not in the right position, and these things need to be addressed. But that's a topic for a different video. For this, I wanted to really address the two most common reasons why guys come in for revision. And the purpose of this video is really to give you hope. You know, it's really disconcerting and disappointing if you had gynecomastia surgery and it didn't give you the outcome that you wanted. But I want you to let you know that there are options to fix it and to give you the chest that makes you more comfortable in your own skin. I hope you enjoyed this video, and if you want even more information about gynecomastia surgery or FTM top surgery, be sure to subscribe to my YouTube channel, my Instagram, and my TikTok. There you'll find a whole host of posts, behind-the-scene footage to help answer any further questions you might have. Until next time, guys.